Okay, so orient yourself to, once again, this line in the front. The back is a little more flat for sure. So, for starters, the very top is the base. The bottom point is apex. This side over here is left. This side over here is right. Ventral is the front surface. Dorsal is the back surface. Next, sulcus. So you have the atrioventricular sulcus, because this is the atrium and this is the ventricle, so in between there is the atrioventricular sulcus. Then we got the anterior interventricular sulcus. Why is it called that? Because anterior is front and between the two ventricles, so interventricular. Next, pericardium. On this heart, you can actually see some of the lining that covers the heart and goes all the way around it. So most of you guys do not, but pericardium is a bag that covers the heart to reduce friction. Next, inside layers of the heart. Zoom, get closer. Okay, so the outside is considered epicardium, the inside is called endocardium, and the actual muscle is called myocardium. Next, when you open up the heart, you will see on all the valves, you're in the light. You're in the light. Oh, I'm so sorry. So, all the valves have these little strings that are on there. Those strings are called chordae tendineae. Those strings are held on to these little bumps inside the ventricles. That is the papillary muscles. Next, the interventricular septum. So if this is a ventricle and this is a ventricle, in between, the meat that's in between, that is the interventricular septum. Next, you have the right side. So going underneath the right atrium, that is going to be considered the right coronary artery. So it just points in this direction. Then going around the edge, you're going to find a blood vessel that goes down. That is the marginal one, or the right marginal artery. And then in the very back, there's the one that's right here. That is the posterior descending artery. Next, let's go left instead. So, again, this is the left atrium. So underneath there is the left coronary artery, and then it breaks down here as it goes down the sulcus. That is the left anterior descending artery. Then if you keep going around the corner, around the atrium, basically underneath this atrium here, as it turns, that is the circumflex artery, or the, as it says, left circumflex artery. And then going down this way, that is the left marginal artery. And then last but not least, the veins. Basically, once you get here, this is the left atrium. So once you go underneath here, that would be considered the small vein, or small coronary vein, and then the closer you get towards the back is the greater vein. And then in the very, very last, where it starts opening up and becoming a little more purple, that is going to be the coronary sinus. And you're done. Feel me?